Hello.
Hi, doctor.
Hi, my name is Andy, one of the doctors from the practice. Am I speaking to Emma Walker?
You are, yes. Hi.
Hi, Emma. Good morning. How are you doing?
I'm good, thank you. I've woken up with a red sticky eye, well, for a few days now, actually, and it's been getting really more uncomfortable. I sent a picture via online so you could see how it looked as well.
Yes, Emma. We got a picture of your eye this morning. And so, I mean, looking at this picture, it looks like it could be causing a lot of discomfort.
Yes.
I'm sorry to see this. Can you tell me more about this?
Yeah, so it started 2 days ago, and it just felt uncomfortable, and it started feeling a bit sticky in my right eye. Um, it's obviously as you can see, it's red, and it feels like it's got grit, like it's gritty inside it, and there's a bit of yellow discharge. Especially when I wake up in the morning, my eyes are stuck together. So yeah, and it's itchy as well.
Okay. So in order for me to understand better what's been going on, I know you've mentioned that it's been red in the last 3 days, sticky and all that. I would just like to, ask some more questions about this.
Yeah, great.
Right. So did you sustain any injury to your eye at all?
No injuries, no.
Okay. Have you noticed if there's any, any pain associated with this?
No, there's not. Well, it's not painful. It's just like uncomfortable, itchy.
Hmm. Has this happened to you before in the past?
No, never.
Okay. Looking through your notes as well, I can see that you have a past medical history of hay fever.
Yeah, so I do suffer from hay fever and I take loratadine when I need it, but this feels different to like my hay fever kind of symptoms.
Oh, okay. Sorry to hear. So since this has started, what have you done in terms of, helping yourself?
So I've been helping. I've been washing it out with some water, just to try and help it. Yeah.
Okay. So apart from this, how has this affected your day to day?
No, it's been fine. I've been able to. I've been working from home because I don't want to give it to anyone at work.
Oh, that's
So I suppose it's been affecting my work life because I've had to do it at home.
mhm. Okay. So, well, there are a couple of things that could cause this, and there are a couple of things that's running through my mind that could be a cause. Is there anything running through your mind at all as to what the cause of this might be?
No, I think maybe is it. I don't know if it's an infection. I'm just worried, obviously, because is it contagious? And obviously, I wanting to go back to work, but I don't want to go and spread anything around for them. So
Yeah, that's kind of you. I know if this happens, it could easily spread from one person to the other. And then you say you've been working from home.
yeah.
Yeah, right. So is there anything that worries you about this apart from, the not wanting to, spread it at work?
No, nothing major. I don't think so. They're just, well, actually, it's like I'm a bit worried because I've never had anything with my eyes before, so I don't really know. But is this a long-term thing? Will this affect my eyes in the future? Am I going to need to wear glasses or anything, or will it take a while to clear?
Okay.
Not too sure.
Right. I can see you've got loads of concern. In
Mm.
order for me to be able to answer that question at the end of this consultation, just a few bits of more questions just to understand better. All right.
Okay, yeah.
Okay. Right. So I would just like to double check with you. Is there any family history of eye problems or maybe glaucoma or something like that?
Not that I'm aware of, no.
Okay. Right. So as well, you mentioned to me that you work from home. What do you do for a
Yes.
living?
I work in HR.
Oh, okay.
Yeah, in a shared office.
Oh, that's fine. Right. So how has this red eye or this symptom affected your work, for instance?
Well, I'm having to do my job role from home instead. So it's not affected it too much. I can still do the job, but obviously I like going into work and seeing the colleagues and having a chat and stuff like that. Yeah.
Yeah. Is there any temperature?
No temperature, no.
Okay. Any pain on your face at all?
No.
Okay. Right. So at times, some of the things we do, like in terms of our lifestyle, can be related to this symptom. Do you smoke?
No, don't smoke, no.
Oh, okay. Right. So you said do you want to tell me some of the things you've done apart from washing your face in terms of, these symptoms?
That's all I've really done, to be honest, is just wash it with some water.
Mhm.
I've not tried any drops or nothing like that, no.
Okay. Is there anything you're hoping that we'll do for you in this consultation?
I'm hoping maybe I don't know if I need some drops for it to keep it like get it better, or antibiotics. I'm not too sure.
Oh, okay. Right. So, from what you've told me so far, Emma, you said you've noticed this red eye in the last,
Yeah.
3 days. It's quite sticky and gritty. You're worried or concerned if this is an infection. So a couple of things running through my mind from the picture I've seen. And you've also told me that this is also only on your right eye. So, yeah, I mean, a couple of things. Well, I'm thinking of if this could be, an allergy, even though you say this is not likely to be an allergy thing. Again, I'm also thinking whether this is, maybe glaucoma, or it could be an infection, just a couple of things.
What's glaucoma?
That's, I'm sorry for using a large, medical term for it. That's an eye, raised pressure in the eye can cause red eye. Yeah.
Right, okay.
So
do you think that's what it could be?
Well, it's just one of what I'll call a differential in this case,
Okay.
which we'll need to, explore.
Yeah.
But there is no family history, so it's not likely to be, possibly conjunctivitis, which is inflammation of the eye.
Yeah.
Do you understand what I mean?
Yeah, I get that.
Yeah. So, but in order for me to, know how to manage you, I was just wondering whether it would be okay for you to see us so that we can have a look one-on-one.
Yeah, no, that's fine. Yeah.
Okay. I know you say you're working from home and you like to go back to work quicker.
Yeah.
So how quick do you think you can, attend the practice so we can have a look at your eye?
It'll have to be after work hours, so after like 5 p.m.
Okay. Right, that's fine. Yeah, we can ask the reception to book you in.
Okay.
Yeah, what we need to do is to have a look at your eye, and see what's been going on there. We could as well, if the discharge is there, we could as well take a sample of that discharge just to send it off.
Right. Yeah. And what would the treatment be? What do you think?
So it depends on what we think it is. So if we think this is an infection, usually what we do is, there are things you can do for yourself.
Yeah.
In the meantime, and there are things we can do for you as well.
Mm-hmm.
So if we think this is an infection, we could, prescribe some. Well, in most cases, most of the infection is likely to be viral.
Right. Okay.
Cases, yeah. But we'll just like to take a swab of that just to be sure there is no bacterial infection in it.
Yeah.
Mm-hmm. So we could just advise to keep washing your eye. Normally, it resolves over, a couple of days.
Yeah. Okie dokie. That's fine.
Yeah. Do you have any? Is that okay with
I'm just worried, is there any like long-term problem? Will this cause any long-term damage or anything like that?
So the only thing about it is that if it's not well treated, it could cause some damage to the eye, affect the vision if it's not well treated.
Right. Okay. So what would the treatment be? Some like eye drops or something?
So for some people, we could try, an antibiotic eye drop in the first instance, if that's going to help.
Yeah, that sounds like a good idea. Is there anything I can do in the meantime before I can get to the surgery? Do I need to do any drops or anything like that?
Okay, so what we will recommend is that in the meantime, just to protect your eye from dust or sunshine or something like that.
Okay, yeah, no problem.
We could recommend maybe wearing of dark goggles, something like that, if you can get it. Do you think you will be able to get that? Okay,
yeah, I can try that. Yeah, that's fine.
Okay, right. So we always recommend self-care measures in the first instance before we actually see to talk about that. Is that okay?
That's great. Yeah, thank you.
Okay. So I think I forgot to ask initially because there were other things that we could consider actually, because for some people we might want to ask about, some private questions from them, like possibly, sexual history. I don't know if you're comfortable for me to ask a little bit about that private.
Yeah, no, that's fine. Yeah.
Oh, okay. Right. So have you been diagnosed with a sexually transmitted infection before?
No.
Okay, that's fine. I'm asking because occasionally when people have sexually transmitted infection, it can also affect the eye as well. So
right. Okay. No, not that I'm aware of anyway.
All right. Is there anything else you'd like to ask me?
No, I don't think so. So the plan is for me to come and see you later on today for you to come and obviously take a swab of my eye and decide from there what we need to do.
Exactly, yes. So have a look. So we can also, speak to if we find out that this is, something that if you have pain, for instance, we could speak to the eye clinic and see if you can be seen accurately if there is pain in it, just for them to check the pressure on the eye. Yeah, what do you think about that?
Yeah, no, that sounds great. Yeah, definitely.
Okay. We're just trying to rule out every possible thing that we could do and the
I'm
most
happy.
serious complication of this. Is that okay?
Yeah, no, I agree. Thank you.
All right then. So in the meantime, if you feel that you notice any pain on your eye, if it's getting worse, any facial pain, any for instance, you notice any sensitivity to light or those kind of things, please could you ring 111 or speak to us again before the is that okay?
Yeah, no, that's great. Thank you.
All right. So is there anything else I can help you with today?
No, not at the moment. Thank you, doctor.
Oh, okay. Thank you very much. So we'll ask one of our receptionists to book you in just to see you today.
That's great. Thank you so much.
Yes. I'll also recommend a leaflet for you, on the NHS website, which talks about conjunctivitis, which is the most likely diagnosis in this case. So you can have a quick read about it. Is that okay?
That's great. Thank you so much.
All right then. So before we go again, can I ask, do you drive?
Yes, I do.
Oh, so if this is affecting your vision, do you think you'll be able to drive to the practice to see us?
I'll ask my partner to help me drive over.
Okay, that's
He'll
good.
drive me, yeah.
All right then. Thank you very much. See you soon.
See you later. Thank you, doctor.
Thank you. Bye-bye.
Bye.
Thank you for our players. Thank you so much. And right, Andrew, right?
Yes.
Right. Hi. Thank you, Andrew. I think well done, guys. You and Reem. All right. So, guys, I will give you a feedback, right? And then you probably, guys, will. If someone would like to add anything, feel free to add anything. Andrew, I like your empathy. I like your IPS. You really have very good IPS. I think you did ask good questions, and you did go to the management even before 6 minutes, which was really amazing. That's really good. Before I go in specific and tell you what you have done in specific, what do you think about what you have done?
I think I missed psychosocial and some bits of psychosocial, like driving, family. Yes, then I think I forgot to ask about sexual history when I was trying to think about chlamydia, but I was trying to look for her.
Get to it later, and I don't think sexual history is that much important here.
Actually.
Okay. But you came to it later, which is okay. Which means that if you guys forgot something and you think it can make a difference, yes, come later to it and ask about it. Don't ignore it if you think it will make a difference. Actually, sexual history here, I don't think it can make a difference. I think there was some other stuff that probably could make a difference. What else? What was your diagnosis here?
I was thinking it was conjunctivitis too.
All right. So you think it could be conjunctivitis, yes?
That's what I was thinking. So I think I didn't ask about rash or what other things that could have made it.
I have written rash, not only this. I have written rash. You did ask about, for example, joint pain rash. For example, if it is spondyloarthritis or rheumatoid or systemic lupus. We'll come to what did you miss, which I think you should ask very clearly in this. But in general, I think you managed the case in a good way in terms of you did ask some questions, which was really good. Then you move to the management early, which is amazing. Your IPS is really good. So your IPS is okay. Your tone is up and down at some points, not all the time, up and down, which is good. Let's go through everything, and then I will tell you what you have done, what you have missed. So you started very good looking at the picture. It could be causing a lot of discomfort. I'm sorry to see that or hear about that. Tell me more. So you started with reflecting on the notes, amazing, and then you told her, tell me more. So you open questions, very good. And then you told her, in order to understand better, I would like to ask you a few more questions. And you asked about any injury, well done. Any pain, does it hurt you? You asked about, did it happen before or no? and you ask it what you have done for it so far, how this is affecting you on a day-to-day basis, and then you told her a couple of things that may also be causing or contributing to it. But do you have any thoughts at all? Which is okay. She told you that could be infection or something, and she was worried that it might spread it to others, and also it can have a long-term complications, and will it affect her eye in the future? Then you told her to be able to address all your concerns. I need to ask a few more questions because she had probably many concerns spreading to others or infecting others or affecting her on the long term. Then you started to ask about work, lifestyle, smoking, any temperature, and you asked about expectations. She told you maybe drops or antibiotic, and you started your management in a good time. Very good. What you have missed here, did you ask about any visual change? I know you caught yourself at the end. You know when you told her, do you drive? Is your vision affected?
I realized very lately, yes.
I can't imagine you are doing ophthalmology case without asking about visual change. It's super important. Have you asked about headache, nausea, vomiting, halos around the light? Any red eye, especially acute red eye, you need to rule out glaucoma. You need to ask about headache, nausea, or vomiting, all of this. She told you it doesn't hurt. I don't know why you told her glaucoma is one of the top differentials or one of the differentials. We need to rule it out. Please come for face-to-face. If we suspect glaucoma, you don't waste your time to bring the patient. If you suspect glaucoma, you send the patient immediately to A&E or ophthalmology. This is the only thing I would listen. I know it is conjunctivitis. Even you told her the diagnosis the last few seconds. The last few seconds, I will give you leaflets from NHS about conjunctivitis because I think it is the most likely possibility or most likely diagnosis here. So you started your management. I'm not sure. It could be conjunctivitis. It could be glaucoma. So I need to see you face to face to ask or to examine you. I would say I will ask who is most likely diagnosis, especially is less likely to be glaucoma. Is less likely. And she told you it has yellowish discharge, yellowish sticky discharge. Why glaucoma will have this? She told you I have yellowish sticky eye discharge and my eyelid is sticky in the morning. It's bacterial conjunctivitis, not even viral. You told her most of the eye infections are viral. Yes, but in this case it was bacterial conjunctivitis, and she gave you the clue already. Yellowish discharge, sticky eyelids in the morning. Okay. So I think you approached the history taking okay. You started your management in a good time. Your IBS is good, but the management, I don't know what happened, but you mixed it up the management, and you started to tell her come for face to face. It might be glaucoma. We need to rule it out. You didn't tell her the diagnosis. You told her most of the infections are viral, but you didn't listen to her very carefully because she told you all the cues about it is infective conjunctivitis, is not glaucoma, is not something serious, not migraine, nothing. What else probably you could do? She asked you what was her worries?
She said maybe she doesn't want to infect others at work.
Yes. Have you brought this in the management and addressed her worries? Right. So guys, please don't forget. We just finished the IPS workshop and we told people, I know you know that she is worried about this. Okay, but because you didn't address it the first line in the management, you may forget, or even if you didn't forget and the patient started to ask you many questions, you will not have time to address the concerns. And this happened in the exam. This happened to me, happened to other colleagues as well. If you don't finish addressing the eyes first line, you probably will get stuck in the patient questions, or you may forget. The best approach, finish addressing eyes first line in the management, so you address all the eyes. Okay. So yes, it could be infectious. However, you don't need any exclusion, just good hygiene, hand washing, avoid sharing towels or utensils. It will not spread to others. Yeah, it could be infectious, okay, but with good hygiene, you don't need to exclude yourself from others or away from others. You can continue working. It doesn't have any long-term complications. Especially, it is actually self-limited conditions. It will get better by itself, even if it is bacterial. Yes, even if it is bacterial. SCA says you don't need to give antibiotic for bacterial. However, it might speed up the recovery by a few days. So you can offer. It's not absolute indication. You can offer in some certain points. We'll come to this in the flashcard, guys. I summarized CKs for you about infective conjunctivitis. The 3 categories I summarized for you. Also, I wrote, sorry, because I wrote in the back of the paper, didn't ask about if she wears any contact lens. Is also important. Is also important. More important than sexual history here. You may ask, even because I wrote, you also didn't ask about any, herpes simplex. Because if there's any vesicles around the eyes, she needs to go to ophthalmologist straight away. If you suspect it could be herpes. That was more important than sexual history here. So this patient, you can manage here without even face-to-face. Most likely it is bacterial infection, self-help measures. It could be infectious, but you need to take very careful hand hygiene. We'll give you a leaflet, you safety net here. And you tell her that address her concern. Most likely, most of them settle down without any treatment, without any long-term implications. Okay. Also, you may ask about what? Other questions. You may ask about any recent viral infection symptoms. It could be a viral conjunctivitis, any upper respiratory tract infection symptoms. It could be, again, viral infection. So you can ask about other viral infection symptoms as well. Okay. I think your IPS is really good, and your IPS will definitely help you in the exam. Okay. And I know how you are linking to, you don't jump. You tell her maybe a few questions, it could be related. You have many concerns. To be able to address all of them, I need to understand more, so I need to ask you more questions. That's really good. Sometimes what we guys advise, try to signpost. For example, acute red eye, sometimes caused by viral infection. Did you have any recent flu-like symptoms? Any runny nose? Any sore throat? Something like that. Okay. Also could be caused by, bacterial infections as well. Anyone else in the family with similar symptoms? Okay. What about the other eye? All of this. And so on. Could be linked to other autoimmune conditions. And if this is the case, usually people will come with joint pain, skin rash. Do you have any of this? You just signpost this. Signpost if you have time and if you know how to give the rationale why I'm asking about joint pain if you are coming with eye pain or red eye, because it could be linked. Some conditions can cause this. Okay, but well done.